Hi there, my name is Nava Bavaghar. I'm a third year nursing student at McMaster University. McMaster is known for its nursing program because of what's called PBL, problem-based learning. I chose McMaster actually because it's located in Hamilton, and Hamilton is a very healthcare-oriented city. There are so many different hospitals in and around the Hamilton area. So I knew throughout my years of nursing that I'd, have experience at, a pediatric hospital, a hospital known for their, cardiac and stroke units, and there's a lot of different variety. So I'm really appreciative of that. That's why I chose Hamilton. The culture in McMaster nursing is definitely very helpful. It's not overly competitive. Nursing is a career that's catered towards helping people, so it's really natural that the students are also, they like to help each other as well. What are teaching styles and workloads like in this program? So, nursing, because it's such a hands-on career, the teaching style does cater to that as well. So we do have like our foundational courses, we have our anatomy and pathophysiology and pharmacology and microbiology. But all of that is kind of in tandem with our clinical practice, where we're seeing the majority of things that we talk about in our classes. So it's really nice to be able to take a class and learn about, a pulmonary infection, and then see that same pulmonary infection in our clinical and be able to, ascertain different nursing interventions to kind of deal with that. So, that's a little bit about what the program is like. It is fairly fast-paced. I think the jump from, second year clinical to third year clinical is pretty big, and I'm sure the jump from third and fourth year clinical will also be big too. But it's definitely manageable, and so far I haven't felt like pulling my hair out, so it's good. To succeed at McMaster Nursing, I think it's really important that nursing students demonstrate a lot of initiative. There's a lot of times in your clinical where you have to speak up if you're not able to, perform a certain task, or if there's, something that you really want to learn about. It's really up to you as a student to make that known to your preceptor or to your assigned nurse. People aren't really going to spoon feed you a lot of materials and a lot of learning. You really have to take that jump and tell people around you what it is that you need to learn, what it is that you're comfortable with, what it is that you're not comfortable with, in order to kind of get everything you need to do throughout the program, get all those lists checked. I really like this question because I think when I applied to Mac Nursing, I really saw that it would lead to a career in bedside nursing, and I didn't realize that there is so many more options available. Nursing as a field is growing so much, and yes, nurses are at the front lines, they're at the bedside, but nurses are also in the community. Nurses are doing patient education. Nurses are also working in public health, and they're policymakers. So there's everything under the sun, really. If you're interested in healthcare, there's any type of position available as a registered nurse that you would like. I have the option to, if I want to, I can work in an emergency room as a nurse, but I can work in a prison as a nurse. I can work in, a remote reserve in northern Canada as a nurse. So really the possibilities are endless. So that's something I feel like everyone should know about nursing, is that, I think we tend to think of it as like a very small sphere, but it's really large. So nursing as in and of itself, the profession of nursing, people often study nursing and they become a nurse, and that entails so many things. But there's also a lot of ways to further your education after your Bachelor of Science in Nursing degree. A lot of people choose to do a Master's of Science in Nursing. They decide to research a healthcare topic and contribute to academia that way. There's so many options. Nurses can apply to medical school. Nurses can apply to become, a certified midwife, and, that's an accelerated program. It's 2 years. So with nursing, there are no co-ops available. How it's done is that there are mandatory clinical practices that are weaved in throughout the program, depending on the school, from either first year to fourth year or from second year to fourth year. So those are not paid. It's time where, you know, you have a preceptor and you have a nurse working on the unit, and together those two individuals kind of show you how to go about your day as if you were a nurse on that unit. So it's extremely educational. That's absolutely where you learn the most as a nursing student, is in your clinical placement. And as you get older throughout the years, you tend to have clinical placements more geared towards what you actually want to work as. So fourth year, you have a lot of option, and you can kind of decide for yourself if you want to pursue nursing in public health, if you want to pursue nursing in, you know, labor and delivery units, in, you know, a surgical unit. So there's a lot of leeway as you go on through the years, for sure. And so I believe McMaster Nursing, the cutoff date is in February. Sorry, it might actually be January. The application deadline is in the early part of the year. I think in first year, this is absolutely something I struggled with. First year, they hit you with a lot of, you know, really heavy courses like your anatomy and physiology and your human biochemistry. I think one of the biggest mistakes I made in first year was thinking that I had to study really by myself. As I've gotten older, I've realized that when you study with more people and you're talking about, you know, these different, you know, organ systems, or the etiology of this disease, or, you know, the pathophysiological process of X, Y, and Z, the more you talk about it, the more it actually reinforces your learning back in your head. So the biggest suggestion I have is to study with people where you can talk about what you're learning. Yes. I think also, you know, memory is really important in terms of, you know, doing well in a course. Like doing well in pharmacology does require a lot of memorization. So, you know, being diligent to kind of perform that, you know, whenever you need to. But, you know, equally important is knowing how to problem solve and how to relate a lot of what you learn in a course to different clinical scenarios that you might encounter as a nurse. So I would always recommend, you know, when you're studying for your pharmacology class, to Google, you know, NCLEX questions related to different pharmacology, you know, subjects. So NCLEX is actually the exam that nurses take at the end of their 4-year Bachelor of Science of Nursing degree, and that's what essentially makes you board certified as a registered nurse. But yeah, throughout nursing school, what's really helpful is Googling NCLEX questions and then the topic that you want to Google these questions. So NCLEX questions, pharmacology, that helps you, it gives you a lot of clinical scenarios and it really prepares you for the NCLEX. So that's my tip for anyone going into nursing. Residence was really great. I did live in residence. Pros and cons. So the pros are definitely that you meet a lot of people. I was able to meet a lot of nurses and we, you know, helped each other get through first year together that way, which was really nice. Cons, you know, it is a big adjustment moving away from your family and living in res. I think the biggest thing that I missed was like that feeling of comfort. I obviously couldn't fit a couch in my bed at residence, so I really missed kind of like lying down on my couch and relaxing. I don't think residence was very conducive for that kind of environment, but it was really good. There are a lot of clubs in terms of nursing that you can get involved with. At McMaster, we have something called MUN, so McMaster University Nursing Student Body. But yeah, the Faculty of Nursing, there are a lot of clubs on campus revolved around, you know, the Nursing Society. So I would recommend getting involved with those. Most campuses also have what's called like a first response team. At McMaster, ours is called EFERT. And it's a really good opportunity to get a lot of training in the field of first aid, and especially nursing students, depending on the type of nursing you want to do. It's a really good volunteer service that kind of gets you out into the field and practicing some similar skills. So I would really recommend that too for anyone looking to get involved on campus. In McMaster Nursing, we don't have an exchange in third year like many nurses or many universities traditionally have. What we have is called a global placement. So in your fourth year, you can actually apply to do half of your fourth year abroad, mostly in a developing country. So there's options in Asia, Nepal, India. There's options along in Southern Africa and Zambia and Tanzania, I believe. And then you can also go to the Caribbean as well. I'm in third year, so I haven't had this opportunity, but it's something that I would have really loved to do had COVID not happened. But yeah, there's a lot of ways to get involved internationally as a nursing student, for sure. What resources are available for students. So there's the McMaster Student Wellness Center, and they have, not during COVID, but normally they have drop-in services, so you can drop in anytime to make an appointment. There are always mental health services also available. You can now call and make an appointment, and I've really benefited greatly from the different people working in the McMaster Student Wellness Center. They get you in touch with therapists, so basically whatever you need to kind of ease the transition into school. There's great programs called Mac Peer Connections where you're kind of paired with a buddy that helps you feel less isolated as you navigate through university. Nurses particularly have something called NUBS. It's called Nursing Upper Year Buddy, and they kind of hold your hand and walk you through like the transition to first year. If you ever need any advice, or you're confused how to study for an exam, or just having a hard time adjusting to life as a nursing student, you can always call on your Nursing Upper Year Buddy, your NUB, and they will absolutely help you out. So every first year nurse has a NUB. I think I would tell myself, biggest one is to study with friends. That is super, super important. You can never study everything you need to know when you're sitting in a room by yourself, isolated. I think the biggest one would be to study with your friends. I think being organized is another thing that I didn't really see the value in my first year. And also just nursing school it's the craziest adventure of your life. It's also like so incredibly rewarding, and so I would really take time and value the time that I have in nursing school. I was thinking in clinical the other day that the time we're learning is now. Like, it's so crazy to me that, in a very short amount of time, I'm hopefully going to be a registered nurse and working, these crazy hours per week. I'm not going to have time to ask my clinical preceptor, questions. I'm not going to have time to debrief with, my fellow students. I'm not going to have time to decide, what is it that I want to learn about today, and ask the other nurses on my unit if they can help me, because as a nurse, your shift is just go, go, go. So I think really understanding how lucky we are in this time to be able to have all the resources to have all of our questions answered, and stuff. So I would take that into appreciation a lot more in my younger years as well.